North America faces a concerning measles outbreak. The resurgence of this highly contagious virus has caught the attention of health officials and the general public alike. As of May 3, 2025, over 935 cases have been reported in the United States. This marks a significant increase compared to previous years where cases were in the low hundreds. Adding cases from Canada and Mexico, the total climbs to over 2,500. This rapid spread across borders underscores the interconnected nature of our world and the ease with which diseases can travel. This surge in measles cases is a stark reminder of the disease's potential to spread rapidly when vaccination rates decline. The characteristic rash and high fever are just the beginning of potential complications, which can include pneumonia and encephalitis. The outbreak has raised alarms among health officials, who are working tirelessly to contain the virus and educate the public about the importance of vaccination. Press conferences and public health campaigns are being ramped up to address the crisis. The outbreak is a stark reminder that diseases like measles, once thought to be largely eradicated, can easily return when vaccination rates drop. Historical footage shows the success of past vaccination campaigns, emphasizing the need to maintain high immunization rates. This resurgence highlights the critical need for continued public health vigilance and proactive measures to maintain herd immunity. Community health clinics and public awareness campaigns play a vital role in ensuring that vaccination rates remain high, protecting the population from future outbreaks. Herd immunity is a crucial concept in public health. It plays a vital role in controlling the spread of infectious diseases within a community. It refers to the indirect protection from infectious diseases that occurs when a large percentage of a population is immune to a disease, typically through vaccination. This collective immunity helps to protect those who are not immune by reducing the overall amount of the pathogen that can spread in the community. This immunity threshold varies depending on the disease. For some diseases, a lower percentage of immune individuals is sufficient to prevent outbreaks, while for others, a much higher percentage is required. For highly contagious diseases like measles, a 95% vaccination rate is necessary to establish herd immunity. This high threshold is due to the ease with which measles can spread from person to person. When herd immunity is achieved, it creates a protective barrier, making it difficult for the disease to spread. This barrier not only protects those who are vaccinated but also those who cannot be vaccinated. This protection is especially important for individuals who cannot be vaccinated for medical reasons, such as infants too young to receive the vaccine or those with compromised immune systems. These vulnerable individuals rely on the immunity of the community to keep them safe from potentially life-threatening diseases. Herd immunity is a testament to the power of collective action in safeguarding public health. It underscores the importance of widespread vaccination and community cooperation in the fight against infectious diseases. By working together, we can create a healthier, safer world for everyone. One of the primary factors contributing to the current measles outbreak is the decline in vaccination rates in recent years. The anti-vaccine movement, fueled by misinformation and fear-mongering, has led some parents to forego vaccinating their children. This trend is particularly concerning because it erodes herd immunity, leaving communities vulnerable to outbreaks. The World Health Organization has identified vaccine hesitancy as one of the top 10 threats to global health. The spread of misinformation, often through social media, has amplified unfounded fears about vaccine safety. Addressing vaccine hesitancy requires a multi-pronged approach, including clear and accurate communication from healthcare providers, public health campaigns, and efforts to combat misinformation online. Texas has emerged as the epicenter of the current outbreak in the United States, reporting 683 cases since late January 2025. Tragically, the outbreak has already claimed 3 lives: 2 unvaccinated children in Texas and 1 unvaccinated adult in New Mexico. These deaths underscore the serious health risks associated with measles, particularly for those who are not vaccinated. The demographics of those infected during this outbreak are telling. Approximately 96% of the individuals who contracted measles were unvaccinated. This statistic highlights the effectiveness of the measles vaccine in preventing the disease and underscores the importance of vaccination in protecting individuals and communities. Measles is not a harmless childhood illness. It is a highly contagious and potentially deadly disease. Measles can lead to serious complications, including pneumonia, encephalitis, brain swelling, blindness, and even death. Before the introduction of the measles vaccine in 1963, the disease was a leading cause of death in young children. Measles is spread through the air when an infected person coughs or sneezes. It is so contagious that if one person has it, up to 90% of the people close to that person who are not immune will also become infected. The virus can live for up to 2 hours in an airspace where the infected person coughed or sneezed. Dr. Paul Offit, a renowned pediatrician and director of the Vaccine Education Center at the Children's Hospital of Philadelphia, has been a vocal advocate for vaccination. He emphasizes that the current measles outbreak is a direct result of declining vaccination rates and warns that we are losing our herd immunity. Dr. Offit stresses that vaccines are one of the greatest public health achievements in history, saving millions of lives and preventing countless cases of disease. Dr. Offit has authored numerous books and articles debunking vaccine myths and providing evidence-based information about vaccine safety and efficacy. His work has been instrumental in combating vaccine hesitancy and promoting public understanding of the importance of vaccination. While the scientific consensus overwhelmingly supports the safety and effectiveness of vaccines, there are dissenting voices. Robert F. Kennedy, Jr., the current Health and Human Services Secretary, has publicly downplayed the severity of the measles outbreak. He has suggested that other health concerns, such as diabetes and autism, pose greater threats to children. Kennedy, a known vaccine skeptic, has been criticized for promoting misinformation about vaccines. His views on vaccines are not supported by scientific evidence and have been widely debunked by medical experts. However, his position of authority gives his views a platform, potentially influencing public opinion and contributing to vaccine hesitancy. The current measles outbreak serves as a stark reminder of the importance of vaccination. This highly contagious disease, which was once nearly eradicated, has made a troubling comeback in recent years. The resurgence is largely due to declining vaccination rates fueled by misinformation and vaccine hesitancy. To prevent future outbreaks and protect our communities, we must prioritize increasing vaccination rates. This is not just a medical issue, but a societal one that requires collective action and responsibility. This requires a multifaceted approach, including combating misinformation by addressing vaccine hesitancy and providing accurate, evidence-based information about vaccines. This means engaging with communities, listening to their concerns, and providing clear, factual answers. Strengthening trust in healthcare providers by encouraging open and honest conversations between healthcare providers and parents about vaccines, addressing concerns and building trust. Trust is the cornerstone of effective healthcare, and it must be nurtured through transparency and empathy, and ensuring vaccine access by making vaccines readily available and affordable for all, removing barriers to access. This includes setting up vaccination clinics in underserved areas and providing financial assistance to those in need. The resurgence of measles is a wake-up call. It highlights the vulnerabilities in our public health system and the urgent need for action. We cannot afford to be complacent. Every individual has a role to play in this fight, from healthcare professionals to community leaders and even parents. By working together to promote vaccination, we can protect our communities and ensure a healthier future for all. Let us rise to this challenge and make a difference, one vaccine at a time.